Hey, welcome back to the 260. Today, we are throwing a curveball your way. We're still talking about emergency care, but this time we're adding a little waggle and a few paws, so to speak. Today, we are speaking with Dr. Logan Eicher, who is an emergency vet with knives. He is walking us through what to do with an animal in distress, oxygen administration, CPR, burn care, and just basic first aid. Now, let's be clear, this does not replace the care of humans, which is our primary focus. But when there is no people to treat and you have an animal in need, how can we be good stewards? Let's find out. Okay, so we have Dr. Logan Eicher here, and he's a veterinarian for knives. And can you tell us a little bit about yourself here?
Yeah. Thanks for having me. So, kind of how I got started into veterinary medicine. Grew up on a farm, pretty small farm, but we had cattle, goats, kind of chickens, things like that. So, always kind of loved working with the livestock and really interested in medicine. So I thought, why not put animals and medicine together? It'd be great. So, in high school, I went to Leo High School. We had kind of an extern program where I could go for part of the day to veterinarians and kind of shadow them. So started with a couple mixed animal practices. It was really cool. Got to go out on the farm, help small animals, large animals, kind of everything in between. Really enjoyed it. Thought that was what I wanted to do. And then another extern that I did, I went to Knives, or the Northeast Indiana Veterinary Emergency and Specialty Hospital. It's kind of the mouthful for it. But started working there. They're more exclusively like small animal. Worked with the surgeon there pretty closely. I was like, man, this is really cool. Like we can do a lot of really cool things that you're probably not going to get to do on like a cow out in the field. So really fell in love with that. Kind of stayed on there, started working there in summers, kind of after school, whatever, went to PFW for undergrad and continued to kind of work on any break that I had, kind of continued to, feel better and more confident about the decision to become a veterinarian. And then applied to veterinary school. I don't know if you guys know, it's pretty hard to get into veterinary school, pretty competitive. There's not very many schools for the number of applicants. So I actually got waitlisted. I was like on the very end of the wait list. I was like, there's absolutely no way I'm going to get in, but actually got accepted at Iowa State. Went there, loved it. Like it was a lot of fun. We had a lot of fun. Made some lifelong friends there too. Still thinking that, I kind of before this, like until I went to Knives, I was like, a vet's a vet. Like they don't have specialists, but then like as I started working, like they have surgeons, internists, cardiologists, criticalists, like you can do so much and get so specialized. So really thought that I wanted to do surgery, like all throughout vet school, kind of all my undergrad, like gung-ho, love surgery, love the pace of it and kind of putting things back together was really cool. And then after, so to be able to go on and become a surgeon or a specialist, generally you have to do an internship in residency to get your status. So it's a veterinary internship residency match program or VERMP that you apply for in your fourth year. So I was like, okay, I'm going to apply for this. Ended up matching at Ohio State for an internship. Kind of midway through the internship, kind of switched focuses a little bit, like the critical care side of things, like the animals that come in, the adrenaline rush when it comes in, no one knows what to do. They look to you and you can kind of help these animals and it's kind of instant gratification, right? You can fix them really well, or sometimes, unfortunately, it's not meant to be, but you know pretty quickly. So during my internship, I kind of shifted from surgery. I'm like, okay, I want to do actually critical care now. Really enjoyed all aspects of it when they're in the ICU, kind of tinkering with medications. We would have ventilator patients, things like that. So got to do a lot. So switched over to critical care and then stayed on at Ohio State for a residency there. So spent the 4 years at Ohio State for Iowa State. And then I finished about a year ago at Ohio State and then came back to Fort Wayne at Knives. And here we are. So it's been a great journey.
I was going to say, you were telling us off air that you had a dog flown into you.
Yeah. At Ohio State, there was an incident probably about 2 hours away where there was a canine officer. I think he was actually in the car, but ended up getting shot by a bullet, kind of in a gunfight with this individual. I don't think any of the officers were hurt, but this dog ended up getting a bullet. So they took a helicopter and choppered the dog in, landed in our parking lot. We evaluated it. It was really cool. The dog did great. Like, he was wagging his tail, had kind of a flesh wound, so didn't really need to do anything with him other than like some antibiotics and stuff.
It's pretty epic, though.
Yeah,
That
yeah,
is.
it's
That is
cool.
actually really cool. You
Yeah.
said you had vended patients. Like, do you have? I'm picturing like a hospital, like a human hospital. So is it kind of like that, where there's?
Yeah, exactly. So yeah, we can do, pretty much you think of anything in human medicine, like we are doing it or trying to do it and trying to kind of emulate what they do. So the ventilated patients is a little bit harder. They have to be very sedated. There's a lot of kind of comorbidities that can happen putting a dog on a ventilator as well. But yeah, we were able to do that. We don't have that capability here at Knives yet. There's a lot of, you can imagine somebody just sitting with one dog for 24/7. So there's a lot of training and personnel involved in that. Some of the other like big things like dialysis in dogs or cats even, like that's a capability that, referral bigger universities usually have.
Oh, that's cool.
Mm-hmm.
Oh, I had no idea.
I know, right?
Is it hard to get a dog, or I guess any animal, off ventilation?
Yeah, it is. And like the kind of the overall kind of success rate is about 20% on being able to get them off of a ventilator.
These are
Yeah, so it's pretty. They're pretty. By the time they need to get on a ventilator, they're usually pretty unwell, and usually as you're ventilating, you're going to have something else come up to you. So whether it be kidney damage, liver, a lot of potentials. We did have a case in my residency that we were on the ventilator for about a week straight. So completely, kind of anesthetized or heavily sedated. That one was able to actually come off and go home and have a good outcome. So there are some good success stories. There's, unfortunately more that do poorly.
The whole reason why we have you on here is, I don't know about you, Taylor, but I've been on scene where it's a wreck and the family's okay, but the dog's not okay. Or we're on a fire and we're pulling out animals more than we are people. And it's like, okay, well, we don't have any human victims, but, we have these animal victims. How do we take care of them? And so the first one I want to kind of bring up is fire. So how do we take care of burns, and then specifically like airway? Is their airway kind of the same as humans where like they close up right away?
Mm-hmm. Yeah, good question. So dogs and fires, as I'm sure you guys know, big things are going to be like thermal injury. So they get just the heat of inhaling that hot gas mixture will burn airways, cause a lot of, edema to the larynx and things like that. And then they can also get like carboxyhemoglobin too, where they can't actually transport enough oxygen due to hemoglobin not working correctly. So I'd say that the biggest thing on those patients is going to be oxygen. So getting, whether flow by oxygen, if you can get a mask, some way to deliver oxygen. Oftentimes too, we'll see, and this is kind of not in the emergency setting that you have to worry about it as much, but a lot of times we'll see corneal ulcers too that we would kind of address as we go on. Kind of the hard part, I think, in the field is, you're probably going to be a little bit limited on what you're able to do. So I would prioritize, does the dog have a patent airway? Can we give it oxygen without the dog? Is it freaking out more because you're trying to hold a mask on it? Like a lot of times I think just looking at your patient and being like, all right, you're maybe a little tachypnic, but you're breathing okay. Maybe we just try to get you, to a referral facility somewhere where they can give more sedation and things like that to help keep it calm. But I think if you're able to give oxygen, that would be the kind of the priority. Intubating dogs usually requires, some heavy sedation. But if they're, at the point, and I don't know if we're going to go into CPR, but that would be a big thing.
Yeah, so I did want to talk about CPR.
Yeah, so biggest thing I think when evaluating a patient for cardiac arrest is to not wait and try to make sure that they've actually are in cardiac arrest. So kind of start compressions right away is going to be the biggest thing. And depending on the body conformation of the dog or cat, it's going to be a little bit different on how you actually perform CPR. So kind of the bigger, kind of large, round-chested dogs, we're going to try to get them where we're compressing about a third to a quarter of their chest. And we're going to go about 100 beats per minute or so. We don't want to completely like smash the dog, so we want to go about a third to a quarter, have complete recoil in between.
How do you know where to place your hands?
Good question. So a big dog, we're going to go at the spot where the ribs are the highest. So you're not actually going to go over the heart in a dog of that conformation. You're going to use the kind of the thorax, and that's going to act as a pump to kind of move blood along.
Okay, that's simple.
Yeah.
Highest point.
The highest point.
So dog's laying laterally.
Exactly.
The highest portion of the ribs.
Yep.
Don't try to line up where's the heart and use your X-ray vision.
Exactly.
You're just
Exactly.
simple.
When we get into more of like the smaller, narrow-chested dogs, that's where we're going to try to target more over where the heart would be. So that will kind of come, a dog, you think of like a greyhound where it really narrows down.
Mm-hmm.
So kind of that area that's a little bit more where you think the heart would be. A good way to kind of find out where your heart is going to be in your chest is to take the arm and push back, and this dummy doesn't do it, but where that point of the elbow kind of goes on the chest cavity, that's going to be about where you would aim on that sort of dog. I would say if you don't know, go for the highest point and you should be pretty safe.
When a dog is deprived of oxygen, how do they act? Do they act kind of like humans, like lethargic? Are they going to bite? What are some concerns?
I definitely think the concern for a dog who's in respiratory distress, like they're freaking out, just like a person would be, right? So them trying to bite just to get away from you and just being so scared. So like prioritizing everybody's safety would, definitely be high on the list. As far as they act, probably, lethargy. We can see them kind of just gasping for air, kind of neck stretched out, increased respiratory rate or effort too, or kind of be the big things that I would look for.
And now you said outstretched airway. How should we position animals' airways? Like, is it?
Yeah.
When I think of like humans, we think sniffing position or like.
Yeah, good question. So a lot of times what we'll see is like a dog who's really unwell is going to be in a lateral recumbency, right? So they're going to be laying on their side.
Mm-hmm.
When they do that, they're actually compressing that lung that's on the closest to the ground. So the ideal position would be sternal, or getting them up, kind of sitting on their.
That's how you normally see a dog.
Yeah, how you should normally see a dog, exactly. And then trying to get some form of oxygen into them.
Are cats the same way?
Yeah, cats are similar too. Cats are kind of a tough species sometimes to deal with. Probably the scariest emergency, I would say, is a cat who's in respiratory distress, because you overwork them, you try to restrain them, they can essentially die very, very quickly from just the stress of trying to help them. So that's challenging. Oftentimes what we will do is give some sedatives, put them in just like an oxygen chamber, which I don't know if that would be very applicable to you guys out in the field, but I'm trying to get, oxygen to them again without restraining them too much. If they don't tolerate like a mask, maybe just like a hose stopping close to their nose or something. So kind of yeah, exactly. Yeah.
Or putting them in a cat carrier. What about, so do dogs and cats, do they hide differently in fires and in car wrecks? Do you notice that? Like, do cats like to flee and hide under the bed?
Yeah, it's a good question. I think it would probably depend a little bit on the animal. Like, I haven't had to go out and evaluate a fire scene at all, but I'll say some animals are, if they see something, they're going to just run away, like in the opposite direction. Some are probably going to go back to wherever they're most comfortable, which may be inside of the fire, right? So I think probably every animal is going to be very different on that. But I would say, looking under beds, in closets, things like that, where cats cats would probably be the hardest ones where they commonly would want to hide.
Good hiders.
Yeah. There is also, and I don't have any with me, but Knives was going to make some, kind of like magnets or stickers to say, I have this many animals in my house in case there is some sort of fire or something like that. So I don't know if you guys would be interested in that or.
Oh,
That'd be helpful.
Yeah. I got a boatload of animals in my house. I want them all safe.
Yeah, exactly.
I wanted to ask you, so you started to talk about airway. Are there any airway maneuvers as far as opening the airway that are specific to a canine or anything like? Because, for example, the human, we're going to do a head tilt chin lift or a jaw thrust.
Yeah.
But what about in like different species? Are you doing anything like that?
Yeah, I'd say the biggest thing we'll do is, in what's a little bit hard is like you think of a dog and the difference in their anatomy is, think of like a bulldog smush face, and then you go up to your husky or a Great Dane. Everyone's anatomy is so extremely different. A lot of times, what we'll do on a dog who's in respiratory distress, struggling to breathe, is kind of out of it and can't, is actually putting something, and we'll often use like little tape, just putting it like in their mouth between their canines just to kind of prop that open a little bit, so it kind of allows more air to flow through. I see that most commonly probably on like the brachycephalic dogs who already have a very narrow nose opening, so can't really pull in air that well anyway. And then you add on a smoke inhalation, and it kind of makes it all worse. So I would say that'd be the biggest thing. Not necessarily, I think sternal recumbency. I usually will put something under their head to kind of keep think of like a normal anatomic orientation where how would they be if they're standing, breathing, how would their neck and kind of mouth and everything like that align, if that makes sense.
So just try to align to their neutral position best you can, depending on the breed.
Exactly, yeah.
There's not going to be a one size answer.
No.
Yeah.
They're not like humans. Okay?
Yeah.
That's the reason why their field is so competitive.
Yeah.
Yeah, it makes sense.
Let's talk about motor vehicle crashes.
Yeah.
All right. And like I said earlier, I've been on one where it was a rollover. Dog wasn't okay. Family was fine. Like they were out walking, but they hand me their dog that is gasping for air. What are some things that like we can do, if there's anything we can do?
Yeah. No, absolutely. And I think that's probably one of the more common emergencies that we'll see, not necessarily a dog being in a vehicle that's crashed, but a dog getting hit on the road. Like that's probably one of the more common big emergencies that we'll see. When I would go about evaluating it, I'm going to look at, breathing, how are they breathing? What's their breathing pattern? A lot of dogs are going to get pleural space disease. So whether it's pleural effusion, if they're bleeding from something, pneumothorax is a big one. Oftentimes they'll get contusions or like lung bruising too, just from the impact. So I would say that the dog who is, gasping for air, mucous membranes are turning blue, purple, things like that, I would do a thoracocentesis. And I'll do this routinely if a dog comes in like this without doing radiographs or without doing, point of care ultrasound, things like that. If I'm concerned their respiratory status is going to continue to decline. They can also get, diaphragmatic hernias, so have kind of the barrier between their chest and abdomen compromised and have, changes with that too. Also see a lot of fractures, so broken bones quite often. Sometimes we'll see head trauma too, so a lot of things to consider very, very quickly. I would say that the biggest thing is probably going to be the respiratory component. Like in the field will probably be the quickest thing to, kill them if it's going to.
What about, like, let's say, I'm thinking tourniquets, like they're bleeding.
Yeah.
Can we put a tourniquet? Where would you put a tourniquet on a dog? I'm assuming kind of like humans, is up high.
Yep, exactly. So just proximal to wherever the bleeding site is. Obviously, it's going to work if it's on a distal, extremity. It's going to work the best. So kind of some good spots probably. So if it's very distal on the front leg, kind of just anywhere in the arm would probably be fine. If it's up a little higher, you can probably get up to past the elbow, and you're probably not going to be able to go much higher than that on the front legs. And then kind of the same deal on the back legs too. So a tourniquet is good. Generally, we'll do like we try not to keep them on longer than like 20-ish minutes. They're bleeding out and dying. Like obviously, let's prioritize that. You can always do like a bandage. So soft
Curlets.
padded band. Yeah,
Yeah.
probably whatever you would use in in humans.
Okay.
Yeah.
So there's a pattern here. The pattern is your ABCs,
Yeah.
essentially,
Right.
just
Exactly.
like humans.
Exactly.
Monitor like you said, there could be a multitude of global injuries, but the ABCs are what's going to kill the animal
Exactly.
immediately.
Yeah.
And so going into overdoses, can we give Narcan?
Yeah. I do. So kind of it's almost like easy to tell which dog is an overdose. Like you can kind of get a little bit of info from how did the dog get presented to us. Is it a young dog who you think would get into something? And then usually if you're going to give it, like you give it IM and they respond pretty quickly, just like a human would.
You can't give it up the nose.
You actually, I was going to mention, there's a recent study out of Penn where they did that. I don't think it got quite as high concentrations, but it was effective at reversing. If you have an atomizer, you can certainly do that up the nose too.
But IM is more commonplace, would you say?
That's probably more common. Or if they're with me, like IV, I would give it IV too.
Is that an experience that you've seen a lot in your practice?
I would say I saw it more in Columbus, Ohio than here, just kind of a bigger, but a fair number of dogs, that come in and we can reverse their, overdose. We also have like a drug screening test too that we can do. I'd say the more common like toxin that we see is marijuana for sure. Like that's
like
all the time.
gummies and
Yeah,
stuff.
exactly.
What about gunshot wounds?
Yeah, so those can be kind of interesting and a huge spectrum of potential complications. So again, kind of depending on where they're hit, I'm going to prioritize like what's their chest cavity, how is their breathing, same thing, ABCs, right? If they do have a lot of bleeding, you can pack it just like you would in a person, right? Trying to control bleeding. If they have, injuries to their legs, trying to get a wrap on that. I think most dogs that unfortunately do get hit by a gunshot or have a gunshot wound, oftentimes if it's a severe wound, they probably succumb to their disease before they get to us. So a lot of the ones we're seeing are going to be like it's either in the soft tissue, it's going through, abdomen, sometimes too. But in those cases, probably just covering it as best you can, getting them to somewhere where they can go in and do an exploratory surgery would be the biggest thing. Pretty incredible. Like I had dogs, they come in, broken leg after being hit by a car, and they're wagging their tail, and like all they want to do is make you happy. It's crazy their pain tolerance and what they can go through.
Yeah. I did have, this was a question from someone that just as a pet owner, how do you tell that your pet is dead? Like, where is a good place to check for a pulse?
Yeah, that's a good question. So I'd say probably the easiest thing would be putting your hand over the heart. So that would probably be the easiest. The other places we check are going to be the femoral artery is probably the easiest. So kind of sliding your hand under the back leg. There's kind of a spot there that you can feel.
Yeah.
It's probably not the best for a layperson to be able to feel it. But I would say if your animal pet is not breathing, you put your hand over where the heart is, and you can't feel heartbeat. That's usually the big things I would
indicator.
look for. Yeah.
You probably put your ear to the area too, I imagine.
Yep. Certainly. Yeah. You could do that as well.
I wanted to ask you, so we were talking about blood loss.
Mm-hmm.
I know we're talking about canines primarily, but
Yeah.
a multitude of species. How do they deal with heat loss? Like, so
Yeah.
if you're losing blood, we're losing heat. But then again, like they have all this fur, and like is it just they lose heat just like we would?
Yeah, they do. So generally, mostly dogs are going to lose heat by like panting, but when they go into hypovolemic shock, which if they're losing a lot of blood, they're going to vasoconstrict everything in the peripheries, try to shunt it to the core, and will often lose heat that way too. Then I don't know, in the field, this is tough, but if a dog, let's say, does lose a lot of, blood in the field, getting them to somewhere where they have blood products so we can give, packed red blood cells, even whole blood transfusions, plasma, platelet products in some areas. But that would kind of be the the resuscitative goals once they got to me.
So you talk about like transfusions.
Mm-hmm.
How do you get it? But also, like, what about different species?
Yeah. No, good question. So,
Like you have a German Shepherd, and then you got a
Basset
Dachshund,
Hound.
a Basset Hound.
yeah. So dogs have kind of they call it the DEA blood group. So there's a few different antigens that they look at, but they're pretty common between all of the different dogs. So DEA1 is the most antigenic. So we generally want to try to match that up with a dog. Dogs are kind of unique that they don't actually have antibody against an antigen when they're born. So none that are clinically significant. So I can give let's say a negative dog positive blood at least one time. If I do it in the future, they're going to have a reaction to it, but I can get away with that one time. But we actually have a blood donor program at Knives, and there's some big places that kind of distribute it. It's very tough to get it, but we get donor dogs. They go through an extensive kind of screening process looking for infectious diseases, blood typing, all of that, and then are able to donate. And we can do whole blood here. Other places will do kind of component therapy too. So packed reds, fresh frozen plasma, plasma, platelet concentrate, things like that. So we can kind of do more component therapy. Cats are a little bit different too. So they have kind of
That sounds like a challenge.
Yeah. So cats have kind of an AB blood type. So, and they're born with antibodies against the other one. So you can't just kind of give a B cat A blood, or they'll have a very severe reaction to it. B is pretty rare and A is pretty common. So we usually can get A blood fairly easily. B blood is a little bit harder to get and be able to give those transfusions.
What kind of blood do you guys keep at Knives? Because you are going to see so many different animals.
Yeah. Generally, we're going to keep packed red blood cells and then plasma or frozen plasma.
For which species, though?
Both. Yeah, for dogs and cats.
Okay.
Yeah, and then we have a donor group that can kind of donate whole blood if needed. And we're probably using our blood product more for like immune-mediated diseases like IMHA or hemolytic anemia and kind of other chronic diseases more so than, a dog that got hit by a car and is bleeding or got shot, things like that. But
how do these animals get to you? Like we got a fire and we pulled out a bunch of dogs or cats, or we have a motor vehicle crash. Like how do these animals get to you typically?
Yeah. So I'll say it kind of depends on kind of what's the state. I think usually owners are going to be bringing, but if owners are, needing medical attention, it's not uncommon that, fire department will bring them straight to us and we can start kind of care, triage, and doing that sort of thing. But it's generally just everything, kind of putting every disease process, usually it's going to be 99% of the time owners are bringing their dogs in. Sometimes animal care and control will get involved too, and they'll kind of take that step from wherever they're hurt to us too for medical treatment.
Do you have any podcasts or book recommendations?
Yeah.
Anything.
I think as far as like medical podcasts that I can think of, kind of veterinary related, I think Vet Girl is probably the most common that most people listen to. There's one out of the Royal Veterinary College that I find pretty interesting. It's like veterinary clinical podcast that's been good. They kind of dive a little bit more into kind of the deeper medicine sort of things. So
thank you for coming on. Very much appreciate it.
Yeah, absolutely. Thanks for having me.
Yeah, and for everyone out there listening, just remember, like, subscribe, and leave it better than you found it.